Hi, I'm Dr. Steve Pearlstein, and this is Second Opinion. Today we're going to talk about sciatica. I've had a lot of requests for a video on sciatica. A lot of my patients think they know what it is. They tell me and they say, I want to know what it is. Please do a video on it. So here it is. And the first thing I want you to know about sciatica, it is more a definition of symptoms than the cause of something. So it's like having a symptom package. You either fit in it or you don't. Now what we're talking about is pain down the back of the entire leg. It could be both legs, but usually is one leg. But down the back of the entire leg. And we're talking about constant burning, sharp pain. It can be dull pain. There can be weakness, tingling. And also it's when you're sitting that you feel this pain more than any other time. So if you have pain when you're standing and then it's relieved when you're sitting, you don't have sciatic pain. And if your pain is down the front of the thigh or the side of the leg or down the back of the leg just to the knee, that's not sciatic pain. So it depends on what your symptoms are, and that helps us understand if you have sciatica. Sciatica, of course, refers to the sciatic nerve. The sciatic nerve, by the way, is the widest and longest nerve in the body. Now, I think the best way of learning about the sciatic nerve and learning about the causes of sciatic pain and what it is to do an anatomy lesson and to do that visually. So to the side of me, there's going to be some pictures and I'm going to describe them. And the first one is the picture of the spine. It's a great picture because it's been divided up into its three functional segments. So you're looking at the back of the spine, and the first section in yellow is the cervical spine. That's made up of 7 vertebrae. Now, the whole column is a bunch of vertebrae, and a singular one is a vertebra, by the way. So you've got the yellow cervical spine, 7 of them. Below that is the blue section, which is the thoracic spine. There's 12 of those. And underneath that is the lumbar spine. That is in red, and there's 5 of those. Now below that, and not colored unfortunately, but you can see it, is a broad bone called the sacrum. And on either side of the sacrum are 2 ilia. Singular is ilium. So a lot of my patients say, Dr. Pearlstein, where is the sacroiliac joint? I think you're getting the idea now where it is. When any 2 bones come together, that's a joint. And where the sacrum joins with the ilium, just alter the words a little bit and you have the sacroiliac joint, and you have the left one and the right one. So that's where the sacroiliac joints are, below the lumbar spine and to the sides. So that's normal spinal anatomy, and right now I want to zero in on the lumbar spine, because when we talk about sciatica, that's where we have to focus. So the lumbar spine, that red part, I want to show you this picture. And this picture shows you a stack of 3 lumbar vertebrae. This is the same 3 lumbar vertebrae, just oriented differently. I want to call your attention to the lavender material. That's the disc, and it's sitting on the body of the vertebrae. And the body of the vertebra, is facing towards the front of us. In the picture on the right, there's these elongated bony processes. Those are called spinous processes, and those are sticking out towards the back of us, and you can feel them. If you reach behind you and poke, you'll feel these hard bony processes. That's that. So again, you're looking at the disc sitting on the body of the vertebra, and the disc is a gelatinous material which is mainly water, and the disc serves to act as a spacer in between bones. It also is a shock absorber, and it is a pump. It brings water in and out, in and out, in and out. That is how the disc maintains its health and its height. So guess what? Exercise is the #1 thing to do to maintain the health of the discs. That's why it's so important. So if you're wondering, should you exercise? Of course you should. The sooner the better. Maintains the health of the discs. The disc is surrounded by a tough fibrous wall, but unfortunately it can be easily injured, and then things happen which we'll go into. I want to draw your attention now to the side of the disc, that large round trunk, which is also not only blue but it's green and yellow. That's the spinal cord, and that's where all the messages go up and down from the brain out to the rest of the body, in and up, back up into the brain. That's a very high complex material, the spinal cord. It is very well protected because you can see it's housed within the spine. You've got to break through the bone to get to that, and that's not easy to do. And off the spinal cord are branches, and these are called spinal nerve roots. They look like little tentacles coming off, and that's how the messages get down from the brain out to the rest of the body, and that come in from parts outside of the spine, into the spine, and up into the brain. Those spinal nerve roots are really important. And you see in the picture on the right, the spinal nerve root is sitting in a groove, if you will. It's nestled in a groove. And if you put a bone on top of that, you have what's called a foramen, or an opening. And that opening is also surrounded by soft tissue. It has a joint capsule, so it's protected, but not as well as the spinal cord, so that can be easily injured, unfortunately. And the nerve root is under a certain amount of pressure. There's gas, there's fluid, but pressure is the main ingredient that allows the functioning of the nerve root, which is to have impulses go back and forth. And that pressure must be maintained. So in a normal spinal anatomy picture like this, these vertebrae can move. They can move front and back, side to side. They can twist, and the disc stays where it is, and the nerve roots and the spinal cord stay where they are, and they don't interfere with each other, and everything is just fine. That's normal spinal anatomy, lumbar spinal anatomy. Now, let's take a look at the sciatic nerve. So the picture you're looking at right now is the back of somebody's thigh, and then a little higher up is the buttock. You can see inside, you can see the hip, you can see an ilium above that, and to the left of that is the sacrum. And then you see this red and yellow thing. Well, that's a sciatic nerve. So I said it runs down the back of the thigh. Now, the yellow part is reaching up into the sacrum. And let me tell you where it originates from. The sciatic nerve originates from the nerve roots of the last two lumbar vertebrae and the nerve roots of the top three nerve roots of the sacrum. So that's 5 nerve roots that join to form the sciatic nerve. So, point number 1, the sciatic nerve is intimately structurally related to the lumbar spine, the sacroiliac joint, the sacrum, the ilium. Very, very important. We'll get into that in a moment. So that's the sciatic nerve. Now, what are the causes of sciatica? How can this sciatic nerve be interfered with? Well, some of the biggest causes are injury. Now, let me say something. Injury can happen in an instant, so sciatic pain can develop in an instant. It also usually develops over time because the effects of injury, the effects of repeated injury, weakening certain structures like the wall of the disc, weakening certain structures like the capsule of the joint that protects the nerve root, weakening certain structures like the connective tissues that help maintain the integrity of the joint structure. Over time, those slowly weaken and can create processes like sciatica. So it is not necessarily the aging process that causes things like this. It is what you bring to the aging process, and injury is pretty much the number one reason why the aging process is affected adversely in this case. So this picture that we have here is a herniated disc, and that is perhaps one of the biggest causes of sciatica. If the material in the disc bulges outward, herniates outward, and interferes with a nerve root that forms a sciatic nerve. In this picture, it shows that the nerve root is red, so it's being interfered with, it's being pinched, and that's a real condition, but that's another term that's used quite loosely. Most people don't have pinched nerve when they just have pain, but all you have to do is have material from the disc herniate outward and encroach upon or crowd, increase the pressure of the nerve root, and it will alter the function and the way the nerve root works, and it will alter the soft tissues, and it will irritate, and it will cause pain, and it can cause sciatic pain. So herniated disc is very important. Now, slip disc that people use so freely is not an accurate term. It suggests that the material inside just squirts right out, and so that's not an accurate term. It's not an up-to-date term, and herniated and prolapsed is a much better term to describe what actually happens. Spinal stenosis, which you may have heard about, is when the material inside herniates into the middle where the spinal cord is, and that's spinal stenosis. So herniated disc can cause spinal stenosis, interference with the spinal cord, or interference with the nerve root. Tumors in pregnancy also create abnormal pressure in the vicinity of the sciatic nerve, and also piriformis syndrome. The piriformis muscle goes from the hip to the sacrum, and the sciatic nerve goes underneath it, and if the piriformis muscle, for one reason or another, is inflamed, it can put abnormal pressure on the sciatic nerve. So, These are the causes. Now, a huge cause, which I alluded to before, was dysfunctional joints. Because the sciatic nerve is intimately structurally related to the lumbar spine, the sacroiliac joint, the sacrum, then if there is dysfunction or not full movement, not full workability of those joints, that will put abnormal pressure on those nerve roots and cause sciatic pain. And that's why chiropractic is one of the most effective conservative treatments for sciatic pain, because chiropractors analyze joint function and correct joint dysfunction. And I've treated hundreds of sciatic pain patients successfully by getting the joints to function again and removing the cause of the pain. So it's really important to understand chiropractic is so essentially effective for that. Now, physical therapy, rolfing, massage, they're all good conservative treatments for sciatic pain. Also, you might have to go into more invasive treatment like injection work, whether it's steroids or non-steroidal treatments such as homeopathics and other types of natural injection treatment like I do. You can learn more about that on my website. Also, if the condition, say of a herniated disc or spinal stenosis, goes a little bit too advanced and conservative measures don't work, then you might have to go to neurosurgery or orthopedic surgery to do certain very invasive procedures that have been proven to be successful. It just depends on how bad the situation is. So I hope that excuse me, I hope that you've learned a lot about sciatica, and now you know more than you ever knew before, and you can tell your friends, have them watch this video. If you're watching this video on Facebook or YouTube, please like the video, and I would appreciate it if you'd like my Facebook page. I would also love to have your comments. I would love to know what you thought of the topic, what you thought of the presentation. Second Opinion is a video series. I've done a lot. I'm going to continue to do more. I would love to hear if there's a topic that you would like me to talk about. Second Opinion is a video series on fitness and wellness and exercise and chiropractic. There's a lot of topics within that. I've got a whole list of them, and I would love to hear the one that I haven't thought of from you. I will probably do a video on it because I want to educate. So again, I hope that you've gotten a lot out of this video. Share it with your friends. Tell them to watch this and like the video. Thanks for watching. I'm Dr. Steve Pearlstein, and this is Second Opinion.